The purpose of the American Nurses Association's Psychiatric and Mental Health Nursing Scope and Standards of Practice is to A. Define the role and actions for the NP. B. Establish the legal authority for the prescription of psychotropic medications. C. Define the legal statutes of the role of the PHMNP. D. Define the differences between the physician role and the NP role. The correct answer is A. Define the role and actions for the NP. The ANA's Psychiatric and Mental Health Nursing Scope and Standards of Practice defines the role and actions of the nurse practitioner. Primary prevention care practices are an essential aspect of the PHMNP role. Which of the following is the best example of a primary prevention care strategy for community behavioral health? A. Aftercare program for chronically mentally ill clients recently discharged from the hospital. B. Court-ordered counseling for abusive parents. C. 24-hour crisis hotlines. D. Parenting skills classes for pregnant adolescents. The correct answer is D. Parenting skills classes for pregnant adolescents. Information reduces incidence of disease. The trend in legal rulings on cases involving mental illness over the past 25 years has been to A. Encourage juries to find defendants not guilty by reason of insanity. B. Protect the person's freedoms or rights when he or she is committed to a mental hospital. C. Place increasing trust in mental health professionals to make good and ethical decisions. D. Decrease the red tape associated with commitments so that commitments are faster and easier. The correct answer is B. Protect the person's freedoms or rights when he or she is committed to a mental hospital. Identifies the trend of ensuring the protection of individual civil liberties for psychiatric clients. Mr. Smithers, an involuntarily hospitalized patient experiencing psychotic symptoms, refuses to take any of his ordered medication because he believes Jesus Christ told me I am the prophet and must fast for a year. Your actions should be based on your knowledge of which of the following? A. Psychiatric clients cannot refuse treatment. B. Psychiatric clients do not always know what is good for them. C. Psychiatric clients can refuse treatment. D. Psychiatric clients cannot be trusted to make good healthcare decisions and, therefore, the nurse's best clinical judgment should guide actions. The correct answer is C. Psychiatric clients can refuse treatment. As with any client, psychiatric clients can refuse treatment unless a legal process resulting in involuntary commitment or mandatory court order for treatment has been obtained. Which of the following statements best reflects the difference between the nurse-client, NC relationship, and a social relationship? A. In the NC relationship, the primary focus is on the client and the client's needs. B. Goals in the NC relationship are deliberately left vague and unspoken so that the client can work on any issue. C. In the NC relationship, the nurse is solely responsible for making the relationship work. D. In the NC relationship, there is no place for social interaction. The correct answer is A. In the NC relationship, the primary focus is on the client and the client's needs. Social relationships are mutual interpersonal relationships in which the needs of both parties are addressed. The NC relationship is most concerned with meeting the needs of the client. A community has an unusually high incidence of depression and drug use among the teenage population. The public health nurses decided to address this problem, in part, by modifying the environment and strengthening the capacities of families to prevent the development of new cases of depression and drug use. What is this an example of? A. Primary prevention. B. Secondary prevention. C. Tertiary prevention. D. Protective factorial prevention. The correct answer is A. Primary prevention. This action focuses on interventions designed to reduce the incidence of new cases of disease. Mrs. Kemp is voluntarily admitted to the hospital. After 24 hours, she states she wishes to leave because this place can't help me. The best nursing action that reflects the legal right of this client is A. Discharge the client. B. Explain that the client cannot leave until you can complete further assessment. C. Allow the client to leave, but have her sign form stating she is leaving against medical advice. D. Immediately start the paperwork to commit the client and to allow you to treat her against her wishes. The correct answer is B. Explain that the client cannot leave until you can complete further assessment. Almost every state allows for a brief period of detainment to assess a client for dangerousness to self or others before allowing the client to leave a hospital setting, even if the admission was voluntary. In forming a therapeutic relationship with clients, the PHMNP must consider developing many characteristics that are known to be helpful in relationship building. Which of the following is an essential part of building a therapeutic relationship? A. Collecting a family history. B. Like-mindedness. C. Authenticity. D. Accuracy in assessment. The correct answer is C. Authenticity. Being genuine, honest, and respectful are essential elements in establishing a working relationship with any client. Like-mindedness is not a part of the therapeutic relationship. Although an important aspect of the PHMNP role, collecting a family history and accuracy in assessment does not in and of itself facilitate relationship building. According to the DSM-5, which of the following is true? A. A mental disorder is equivalent to the need for treatment. B. Diagnostic criteria are used to inform clinical judgment. C. Socially deviant behavior is considered a mental disorder. D. A culturally expected response to a stressor is not a mental disorder. The correct answer is D. A culturally expected response to a stressor is not a mental disorder. All DSM-5 disorders need to be made taking a person's culture into account. A cultural expression of a response to grief, loss, or stress is not considered a DSM-5 diagnosis. Mrs. French has been in individual therapy for 3 months. She has shown much growth and improvement in her functioning and insight, and is to discontinue services within the next few weeks. In the next session, after you discuss service termination, she suddenly begins to demonstrate the original symptoms that had brought her to treatment initially. She is now hesitant to discharge, wants to continue services, and is displaying an increase in regressive defense mechanisms. What is the best explanation for Ms. French's behavior? A. An exacerbation of her symptoms related to stress. B. The normal cyclic nature of chronic mental health symptoms. C. A sign of normal resistance to termination seen in the termination phase of therapy. D. A sign of pathological attachment to the therapist that must be addressed. The correct answer is C. a sign of normal resistance to termination seen in the termination phase of therapy. Clients frequently display resistance and regression at the termination of a meaningful therapeutic process. The PHMNP is responsible for planning an effective termination and monitoring clients during the termination period. A client is displaying low self-esteem, poor self-control, self-doubt, and a high level of dependency. These behaviors indicate developmental failure of which of the following stages of development? A. Infancy. B. Early childhood. C. Late childhood. D. School age. The correct answer is B. Early childhood. These signs indicate developmental failure of early childhood. Mr. Thompson has been forgetful lately, for example, forgetting where he has placed his keys or what time appointments are scheduled, and he has stated that he thinks these are just random behaviors that have no particular meaning. Which Freudian-based psychodynamic principle assumes that all behavior and actions are purposeful? A. Pleasure principle. B. Psychic determinism principle. C. Reality principle. D. Unconsciousness principle. The correct answer is B. Psychic determinism principle. The psychic determinism principle states that all behavior has purpose and meaning, often unconscious in nature, and that no behaviors occur randomly or by coincidence. An example of a mature, healthy defense mechanism is A. Denial. B. Rationalization. C. Repression. D. Suppression. The correct answer is D. Suppression. Suppression is the only defense mechanism listed in which the client channels conflicting energies into growth-promoting activities. Mr. Johnson is a 54-year-old client you have been seeing for several weeks in therapy. While discussing his current concerns of marital stress, he lies on the floor and assumes the fetal position. This is most likely an example of A. Immature regressive defense mechanism. B. Denial of reality. C. Immature fantasy defense mechanism. D. Repressive behavior. The correct answer is A. Immature regressive defense mechanism. Immature regressive defense mechanism is a return to a behavior common to an earlier stage of development. Defense mechanisms are best viewed as a function of the ego. A. To alert us to harm and danger. B. To alert us to problems. C. Used to resolve a conflict. D. Used to protect the ID. The correct answer is C. Used to resolve a conflict. Defense mechanisms are a function of the ego used to resolve a conflict. One of the healthcare changes that has occurred as a result of the Affordable Care Act, ACA, is that doctors, hospitals, clinic groups, or health systems are coming together and assuming the responsibility for quality care to large groups of individuals insured by Medicare. The healthcare clinics, systems, doctors, or hospitals that join together are called which of the following? A. Health Maintenance Organization, HMO. B. Preferred Provider Network, PPO. C. Accountable Care Organization, ACO. D. Individual Health Plan, IHP. The correct answer is C. Accountable Care Organization, ACO. ACOs are groups of doctors or other healthcare providers who voluntarily come together and assume the care provided to Medicare patients. Healthcare economics is concerned with making decisions so the benefits outweigh the cost of resource utilization. What are two concepts that healthcare economics is concerned with in regard to fair distribution of resources and allocation? A. Equity and efficiency. B. Cost and benefits. C. Opportunity and waste. D. Affordable and quality. The correct answer is A. Equity and efficiency. Healthcare efficiency is making risk and benefit decision about how care resources are allocated, and equity is ensuring that there is a fair distribution of the resources. What four elements need to be present for a malpractice lawsuit to be filed? A. Beneficence, non-maleficence, truthfulness, and justice. B. Duty of care, breach of standard of care, injury, and injury must be related to breach of the standard of care. C. Abandonment, breach of care, violation of ethics, and reimbursement for poor care. D. Breach of standard of care, injury, deceit, and malpractice. The correct answer is B. Duty of care, breach of standard of care, injury, and injury must be related to breach of the standard of care. The four elements that must be satisfied for malpractice to have occurred are a duty of care between clinician and patient, breach of standard of care, an injury to the patient, and the patient's injury must be related to the clinician's breach of care. Mary is a psychiatric mental health nurse practitioner, PHMNP, who is working in a hospitalist role. Mary has encountered over 5 incidences in which attending psychiatrists and medical residents have been demeaning to nursing staff and not answering calls in the middle of the night or telling the nursing staff to write orders and the MD would sign off in the AM. Mary is concerned about errors and wants to improve quality, reduce errors to promote safety. What concept is Mary employing? A. Bullying. B. Abuse. C. Civil disobedience. D. Just culture. The correct answer is D. Just culture. The ANA has a position statement that nurses are responsible for developing healthcare settings that include just culture initiatives, understanding that human error can cause error and harm by creating an open and fair environment. The role of neurotransmitters in the central nervous system is to function as A. A communication medium. B. A gatekeeper for transmissions. C. A building block for amino acids. D. An agent to break down enzymes. The correct answer is A. A communication medium. Neurotransmitters in the central nervous system function as a communication medium. Serotonin is produced in which of the following locations? A. Locus coeruleus. B. Nucleus basalis. C. Raphe nuclei. D. Substantia nigra. The correct answer is C. Raphe nuclei. Serotonin is produced in the raphe nuclei. Dopamine is produced in which of the following locations? A. Locus coeruleus. B. Nucleus basalis. C. Raphe nuclei. D. Substantia nigra. The correct answer is D. Substantia nigra. Dopamine is produced in the substantia nigra. A client presents with complaints of changes in appetite, feeling fatigued, problems with sleep, rest cycle, and changes in libido. What is the neuroanatomical area of the brain that is responsible for the normal regulation of these functions? A. Thalamus. B. Hypothalamus. C. Limbic system. D. Hippocampus. The correct answer is B. Hypothalamus. Appetite, sleep, and libido are regulated by the hypothalamus. In considering whether to order an MRI of the head for a client, which of the following would be a contraindication to this diagnostic test? A. Prosthetic limb. B. History of head trauma. C. Pacemaker. D. Pregnancy. The correct answer is C. Pacemaker. A client with a pacemaker should not receive an MRI of the head. The primary excitatory neurotransmitter is A. GABA. B. Serotonin. C. Dopamine. D. Glutamate. The correct answer is D. Glutamate. Glutamate is the primary excitatory neurotransmitter. A client who is experiencing difficulties with working memory, planning and prioritizing, insight into his problems, and impulse control presents for assessment. In planning his care, the PHMNP should apply his or her knowledge that these symptoms represent problems with the A. Frontal lobe. B. Temporal lobe. C. Parietal lobe. D. Occipital lobe. The correct answer is A. Frontal lobe. Problems with working memory, planning and prioritizing, insight into problems, and impulse control indicate a problem in the frontal lobe. The concept of target symptom identification is best explained as A. Identification of the major clinical presentation of the client. B. Identification of specific, precise, and individualized symptoms reasonably expected to improve with medication. C. Identification of the secondary messenger system syndrome. D. Intentional modulation of synaptic pathways. The correct answer is B. Identification of specific, precise, and individualized symptoms reasonably expected to improve with medication. Target symptom identification is the identification of specific, precise, and individualized symptoms reasonably expected to improve with a given medication. The goal of the psychiatric assessment process performed by the PHMNP is to A. Gain an understanding of the life experiences of the client. B. Correctly diagnose the client. C. Identify the mental health needs of the client. D. Be able to communicate with other staff about the client's health needs. The correct answer is C. Identify the mental health needs of the client. Although diagnosis is an important aspect of the assessment process, the assessment ultimately should identify the needs of the client. Mr. Johnson is a client newly admitted to an inpatient psychiatric hospital. The PHMNP on call at the facility plans to perform the initial intake assessment and diagnostic process. Mr. Johnson asks to please talk in his room because, he says, people make me nervous. His room is at the end of the hallway and is the farthest away from the nursing station. The PHMNP's action should be based on awareness that the best location to do the assessment is A. In Mr. Johnson's room, because it is least noisy and most comfortable for him, thus facilitating data collection. B. In the day room, which is full of people, to observe his interactions with other people. C. In a quiet place, but public enough to get assistance with client care should it be required during the assessment. D. In the treatment room with the door closed, a neutral location. The correct answer is C. In a quiet place, but public enough to get assistance with client care should it be required during the assessment. One PHMNP role is to control the milieu as an aspect of assessment, so the PHMNP should choose a quiet place that is public enough to get assistance with client care should it be required during the assessment. Which communication technique is the PHMNP using in the following situation? Client: Sorry I was late. I didn't realize what time it was. PHMNP: This is the third time now that you have been late for our sessions. I am wondering how committed you are to our working on your problems. A. Theming. B. Recognizing. C. Validating. D. Sequencing. The correct answer is B. Recognizing. This exchange is an illustration of the technique of recognizing. In assessing a client, you ask him the meaning of the proverb "People who live in glass houses shouldn't throw stones." He replies, "Because it will break the windows." The correct interpretation of this finding is A. Client has a probable mood disorder. B. Client has a probable anxiety disorder. C. Client has limited intellectual ability. D. Unable to interpret the finding without knowing the client's age. The correct answer is D. Unable to interpret the finding without knowing the client's age. The answer demonstrates concrete thought processes, which are normal in persons younger than age 12, but are abnormal after age 12. To interpret the finding, the PHMNP must know the age of the client. The PHMNP is planning to work with a client using an individual therapy model of care. During the first session, the client makes the following statement: "This is the third time my son has run away. I've grounded him, taken away his bike, even tried cutting off his allowance and confining him to his room. What should I do now?" The most therapeutic response for the PHMNP to make is A. I wonder if confining him to his room was abusive. B. Maybe that depends on what you are trying to accomplish. C. Perhaps talking to his friends and teachers would help. D. Remain silent. The correct answer is B. Maybe that depends on what you are trying to accomplish. This response will be the most therapeutic in moving forward with the client. A client says to the PHMNP, "Some days life is just not worth it. All my wife and I ever do is fight and scream. Things at home would be calmer and simpler if I just wasn't there anymore." The most therapeutic response for the PHMNP to make is A. Do you mean that you are thinking about leaving your wife and moving out? B. Tell me what you mean by "it would be simpler if you just weren't there anymore." C. So you are thinking suicide might be an option for you? D. Remain silent. The correct answer is B. Tell me what you mean by "it would be simpler if you just weren't there anymore." This response is the most therapeutic, allowing the client to further clarify and express feelings. Mrs. Shea has come to the mental health center seeking treatment for depression. She has a history of a suicide attempt by overdose 1 month ago. She was started on imipramine, tricyclic antidepressant, TCA, after that event but stopped taking the medication 1 week later because it did no good. The PHMNP meets with Mrs. Shea to plan care with her. Which of the following is the most appropriate initial action? A. Asking Mrs. Shea how to help her. B. Providing client teaching about the long time frame for TCAs to work. C. Contracting with Mrs. Shea for 6 sessions of individual therapy. D. Providing Mrs. Shea with feedback about how suicide might affect her family. The correct answer is A. Asking Mrs. Shea how to help her. Asking the client how to help is an aspect of assessment. All other answers are aspects of interventions, which are not initial actions of the PHMNP. In completing the PHMNP assessment for Mrs. Shea, the most appropriate lab test for the PHMNP to order at this time is A. CBC, B. TSH, C. Liver function tests, D. Electrolyte panel. The correct answer is C. Liver function tests. Client overdosed and then was placed on a medication that affects the liver. The PHMNP needs to assess the client's liver function as an aspect of care planning for her. A client comes into the clinic with a long-standing history of depression and chronic renal failure. He is on an antidepressant and a diuretic and complains of increased depression, mild confusion, irritability, and overall apathy from being too tired to do anything. The best initial PHMNP action to take at this time is A. Increase his dose of antidepressant medication to better capture symptoms. B. Change him to another antidepressant for better symptom control. C. Augment his antidepressant with an atypical antipsychotic medication. D. Order a comprehensive metabolic panel. The correct answer is D. Order a comprehensive metabolic panel. Client symptoms are consistent with electrolyte imbalance, and a physical cause of his symptoms must be ruled out first. Sarah presents for her initial intake appointment with complaints of depression. She is being treated for hypertension and asthma by her primary care provider. Knowing that certain medications can cause or exacerbate depression, you obtain a complete medication history. Which of the following medications is known to exacerbate or cause depression? A. Omeprazole. B. Propranolol. C. Levothyroxine. D. Clarithromycin. The correct answer is B. Propranolol. Beta blockers can cause or exacerbate depression. When treating older adults, you should keep in mind that they are more sensitive to issues of drug toxicity because of which of the following reasons? A. Decreased body fat. B. Increased liver capacity. C. Decreased protein binding. D. Increased muscle concentration. The correct answer is C. Decreased protein binding. Older adults usually have decreased protein levels. Most psychotropic medications are highly protein-bound. It is the unbound concentration of the drug that is active. The bound concentration of the drug is inert. Thus, with decreased protein available for binding, more free drug remains in the body, which then predisposes older adults to toxicity. Which known teratogenic effects can be caused by the common psychotropic medications Divalproex and lithium? A. Divalproex, Epstein anomaly, lithium, cleft palate. B. Divalproex, spina bifida, lithium, Epstein anomaly. C. Divalproex, limb malformations, lithium, seizure disorder. D. Divalproex, mental retardation, lithium, spina bifida. The correct answer is B. Divalproex, spina bifida, lithium, Epstein anomaly. Divalproex can cause spina bifida and lithium can cause Epstein's anomaly. The study of what the body does to drugs is called A. Pharmacodynamics. B. Pharmacology. C. Pharmacokinetics. D. Distribution. The correct answer is C. Pharmacokinetics. Pharmacokinetics is the study of what the body does to drugs. Your client Sam is being treated for panic disorder with agoraphobia. He currently is being prescribed paroxetine and clonazepam. He has been on clonazepam for 2 years and admits to needing 4 pills to achieve the same effect that 1 pill initially produced. This is possibly an example of which process? A. Kindling. B. Addiction. C. Tolerance. D. Potency. The correct answer is C. Tolerance. Tolerance means needing more to achieve the same effect. Why is group therapy beneficial? A. It assists the client to focus on self. B. It lacks theoretical frameworks. C. It enables participants to acquire therapeutic factors. D. It is always time limited. The correct answer is D. It is always time limited. Group therapy is beneficial because it increases social skills, is cost-effective, and enables participants to acquire the curative factors. Which of the following is the best rationale for using cognitive behavioral therapy? A. Recognize and change his or her automatic thoughts. B. See reality as you see it. C. Change his or her reality by changing his or her environment. D. Recognize and accept that automatic thoughts suggest delusional thinking. The correct answer is A. Recognize and change his or her automatic thoughts. Cognitive behavioral therapy helps clients recognize and change their automatic thoughts. When working with a dysfunctional family, you find that the father, Jim, worries excessively and is resistant to change. You give Jim a paradoxical directive to worry extremely well for 1 hour per day, knowing that he will likely be non-compliant, and thus change will occur. With this technique, you are using which type of therapy? A. Experiential therapy. B. Structural therapy. C. Strategic therapy. D. Solution-focused therapy. The correct answer is C. Strategic therapy. Paradoxical directives are used in strategic therapy. Which of the following best describes homeostasis in a family system? A. Choices a family makes to keep the peace. B. Balance or stability that the family returns to despite its dysfunction. C. Need for change and balance in a family. D. Calm in a family that returns after a crisis. The correct answer is B. Balance or stability that the family returns to despite its dysfunction. Homeostasis is balance or stability that the family returns to despite its dysfunction. In an attempt to bring the client toward the goal he or she is working on, you ask the client, if a miracle were to happen tonight while you slept, and you awoke in the morning and the problem no longer existed, how would you know, and what would be different? This technique is used in which type of therapy? A. Behavioral therapy. B. Solution-focused therapy. C. Adlerian therapy. D. Existential therapy. The correct answer is B. Solution-focused therapy. Miracle questions are used in solution-focused therapy. Ms. Thomas has been diagnosed with major depressive disorder, MDD, and is placed on fluoxetine 20 mg for her depression. For the PHMNP to effectively monitor her use of the medication, which of the following actions should be part of ongoing care? A. Use of a standardized rating scale of depression. B. Monitoring for potential abuse of the medication. C. Monitoring of labs for renal functioning. D. Monitoring for potential cardiac side effects. The correct answer is A. Use of a standardized rating scale of depression. The use of a standardized rating scale will allow the PHMNP to monitor the level of client symptoms and to evaluate the efficacy of the medication. Which of the following is the best reason for considering the SSRI among the first-line drug choices for treating major depression? A. Need to stair-step initial dosages. B. Sedating and calming effect of the medication. C. Safe use in suicidal overdose clients. D. Ability to obtain therapeutic serum drug levels. The correct answer is C. Safe use in suicidal overdose clients. SSRIs are considered among the first-line medications used to treat depression because of safety in suicidal overdose clients. A 23-year-old woman is brought into the ER after attempting suicide by cutting her wrists. Which nursing action by the PHMNP would be of highest priority initially? A. Assess her coping behaviors. B. Assess her current level of suicidality. C. Take her vital signs. D. Assess her health history. The correct answer is C. Take her vital signs. The PHMNP needs to ensure that her suicide attempt has not led to medical instability. Which of the following interventions by the PHMNP for a person experiencing ataque de nervios demonstrates culturally informed care? A. Offering brief supportive psychotherapy. B. Offering a brief hospitalization. C. Requesting a family member act as an interpreter. D. Offering low-dose, short-term anxiolytic medication. The correct answer is A. Offering brief supportive psychotherapy. The literature suggests that although short-term anxiolytic medication may be offered in an emergency room setting, ataque de nervios is best treated by brief supportive therapy by a Spanish-speaking Latino therapist. The PHMNP working at a student mental health clinic has now been working with a freshman student for several weeks. The PHMNP learns that the student considers himself shy. He tells the NP that he has always felt uncomfortable in social situations or when he has to do oral presentations in class. He had few friends up until his senior year of high school, when he discovered he could enjoy himself if he had a couple of drinks before going out. He has continued this pattern in college and now occasionally drinks 2 to 3 beers on weekends as well. According to the DSM-5, does the student have a mental disorder? A. Yes, alcohol use disorder, mild. B. Yes, generalized anxiety disorder. C. No, at this point, the student does not meet criteria for a mental disorder. D. Yes, adjustment disorder with mixed features. The correct answer is C. No, at this point, the student does not meet criteria for a mental disorder. The student does not meet criteria for alcohol use or other disorder at this point, but if he does not learn alternative coping skills to deal with his shyness, he is at risk of developing an alcohol use disorder. Jason misses several appointments. The PHMNP notes she feels resentful toward Jason and is struggling with how to respond to Jason when he finally comes in for his appointment. Which of the following demonstrates a therapeutic response? A. Jason, since you have missed several appointments, we are closing your case. B. Jason, it's pretty clear to me that you don't want to be here. C. Jason, you are ambivalent about seeking treatment. D. Jason, help me understand what's going on so we can figure out how to proceed. The correct answer is D. Jason, help me understand what's going on so we can figure out how to proceed. Although the PHMNP's resentment is in response to actual behavior by Jason, clarifying what is going on for him, his expectations for treatment and the PHMNP's expectations in a non-judgmental manner will help to develop a therapeutic alliance. Which is true about pharmacologic treatment of anxiety in older adults? A. Course of treatment is generally shorter than for younger adults. B. Drugs that are highly oxidized are more unpredictable than drugs that are mostly conjugated. C. The therapeutic dose of SSRIs is generally lower than for young adults. D. Highly lipophilic drugs have a more linear elimination in older adults. The correct answer is B. Drugs that are highly oxidized are more unpredictable than drugs that are mostly conjugated. Liver enzyme functioning diminishes as we age. All of the other statements are false. A client returns for a follow-up appointment 3 weeks after starting on fluoxetine 20 mg. During this appointment you notice that her speech is a little rapid, in marked contrast to the psychomotor retardation and paucity of spontaneous speech she displayed on her first visit. Instead of looking at the floor, she now makes normal eye contact. Her affect has gone from constricted to expansive. She continues to have difficulty sleeping, but her energy has improved and she states she feels so much better. What should you conclude about the shift in the client's presentation? A. She is experiencing the activating side effects of fluoxetine. B. She is becoming euthymic. C. She is becoming hypomanic. D. She is in a mixed state. The correct answer is C. She is becoming hypomanic. In this case, you see a shifting set of symptoms, the most important being her expansive mood and statement, so much better, that indicates she has gone beyond euthymia. Mr. D is a 35-year-old, married, high-tech industry executive who is referred to the PHMNP for insomnia. Mr. D reports that he falls asleep quickly, but has difficulty staying asleep. He wakes up several times during the night, and believes he tosses and turns even when he is sleeping. He wakes up feeling exhausted and drinks a pot of coffee to stay awake and concentrate during his long workday. He drinks 1 glass of wine most evenings. He denies any illicit substance use. He denies any symptoms of a mood or anxiety disorder, but is feeling increasingly frustrated and concerned about his sleep. Which of the following is the most likely contributing factor to Mr. D's ongoing middle insomnia? A. Obstructive sleep apnea, OSA. B. Caffeine dependence. C. Alcohol withdrawal. D. Attention deficit hyperactivity disorder, ADHD. The correct answer is A. Obstructive sleep apnea, OSA. OSA is the only plausible possibility if the rest of the information given by the client is accurate. OSA causes clients to have frequent awakenings and a sense that they are not sleeping deeply, tossing and turning, that is caused by apnea. The client should be assessed further for snoring and awareness of apnea. Although the client states he drinks a lot of coffee, this is driven by his sleep issues. Drinking 1 glass of wine in the evening would not cause the degree of sleep pathology he is exhibiting. Other than diminishing concentration that is consistent with sleep deprivation, there are no other signs and symptoms of ADHD. Tina is a 54-year-old single white woman who has been a psychiatric mental health nurse practitioner for over 20 years. She is considering making an application to a doctor of nursing practice program, but states if a DNP is required to practice I'll get grandfathered in. No need for me to go back to school. Following the 2008 license, accreditation, certification, and education consensus model for advanced practice registered nurse regulation, which statement is correct? A. Tina is correct. If the DNP becomes a requirement, she will be grandfathered in and obtain a DNP degree. B. The DNP is an academic terminal degree, and there will not be an opportunity for Tina to be grandfathered in a DNP. C. Tina will be grandfathered in and obtain a DNP only if her state requires a DNP to practice as an APRN. D. The DNP is a certification and Tina will have to take an examination to be grandfathered in to obtain a DNP. The correct answer is B. The DNP is an academic terminal degree, and there will not be an opportunity for Tina to be grandfathered in a DNP. APRNs are not grandfathered into an academic degree. Degrees must be earned from accredited academic institutions. Tim is a board-certified psychiatric-mental health nurse practitioner, PHMNP, working in a busy community mental health center, CMHC. He is currently seeing a client diagnosed with bipolar I disorder who has comorbid hypertension and diabetes. During the visit, Tim takes the client's blood pressure and her reading is 160/94 millimeters of mercury. The client denies any headaches, nausea, chest pain, or shortness of breath. The client states, "I can't afford all these medications, so I haven't seen my doctor in 7 months, and I am out of all my blood pressure and sugar medications. Can you give me some?" What is Tim's most appropriate action? A. Call the pharmacy to find out what medications the client is taking and refill for 1 month to cover until she can get in to see his primary care provider. B. Tell the client he cannot refill her medications and inform her to go to the emergency room should she develop any signs or symptoms of an elevated blood pressure or hyperglycemia. C. Call the client's primary care provider, explain the situation, and coordinate the client getting an appointment and medication refills. D. Send the client to an urgent care clinic to get refills today. The correct answer is C. Call the client's primary care provider, explain the situation, and coordinate the client getting an appointment and medication refills. It is not within the scope of practice of a PHMNP to treat hypertension. Coordination of care to ensure the client does not run out of medication is the appropriate course of action. The chief nursing officer of a large behavioral health system approached the PHMNP to discuss the new healthcare effectiveness data and information set, HEDIS, behavioral health measures and specifications. The PHMNP is asked to do a retrospective chart review of all hospital discharge clients who received a follow-up visit within 7 days of discharge and within 30 days of discharge. The PHMNP has been asked to engage in which of the following? A. Needs assessment project. B. Plan, do, study, act project. C. A task that is outside of the PHMNP's scope of practice. D. Quality improvement initiative. The correct answer is D. Quality improvement initiative. Engaging in a project to assess whether a standard of care was met is a quality improvement project. A PHMNP who is working on the consult liaison service is referred to a patient in the medical intensive care unit by the attending hospitalist. The consult note read, "Evaluate the patient for competency to make independent medical decisions and consent for a surgical procedure." Based on the scope of practice of a PHMNP, which response would be most appropriate? A. Complete the patient assessment and write up the findings in the patient's medical record. B. Complete a patient assessment, including the mini mental status examination and family collateral data to determine competency. C. Call the hospitalist and provide education that competency is a legal concept and explain that you can assess the patient for the capacity to make medical decisions. D. Refuse the consult and inform the hospitalist that this is outside your scope of practice. The correct answer is C. Call the hospitalist and provide education that competency is a legal concept and explain that you can assess the patient for the capacity to make medical decisions. The legal system makes determination whether a person is competent. Practitioners can assess and make a determination about a person's capacity to make medical decisions. You are asked by a church organization to work with members within your health system to develop a flu vaccination program. According to public health principles, this is an example of what level of prevention? A. Secondary. B. Preventative. C. Tertiary. D. Primary. The correct answer is D. Primary. Prevention of illness is primary prevention and administration of flu vaccinations in a community is intended to prevent a flu outbreak. A client with bipolar I disorder presents to your PHMNP office for a follow-up visit. During the visit, the client informs you that he no longer wants to be treated with medication, and he does not have bipolar disorder. That was a misdiagnosis. He further informs you he stopped all his medication 2 months ago and is here to thank you for your care and tell you that he no longer needs follow-up appointments. Understanding the ethical conflict, you use which of the following ethical principles in working with this client? A. Autonomy. B. Non-maleficence. C. Justice. D. Beneficence. The correct answer is A. Autonomy. Clients who are legally competent have the ability to make medical decisions and maintain individual autonomy. A new client reveals to the PHMNP that her boyfriend screams at her and has repeatedly slapped and pushed her in front of her 3-year-old son. She goes on to say that the boyfriend has thrown things at her and on one occasion threw a glass of water at her that hit her son in the back. Should the PHMNP report this to Child Protective Services, CPS? A. Yes, the client is issuing a cry for help for her son. B. Yes, the PHMNP has a duty to report. C. No, this does not constitute a reportable offense. D. No, a report to CPS will escalate the violence. The correct answer is B. Yes, the PHMNP has a duty to report. PHMNPs are mandated reporters of child abuse. The 3-year-old is being exposed to violence and, although not the target, could have been injured when the boyfriend threw the glass of water. Which of the following is a function of the psychiatric interview? A. Understand the client's psychosocial needs and communicate them to the treatment team. B. Identify the mental health needs of the client. C. Review previous medical records. D. Evaluate a treatment plan. The correct answer is B. Identify the mental health needs of the client. During a psychiatric interview, the PHMNP is responsible to identify symptoms and needs of a client to develop an appropriate treatment plan. A 74-year-old married white woman was referred to you by her primary care provider for a psychiatric evaluation. She had a normal medical and neurological examination in the last 2 months. The client presents with her husband of 45 years who states, "My wife is just not the same anymore. She is irritable and asks the same question several times, even though I've answered it many times." The client responds, "Oh, Henry, you do the same thing. It's just a normal part of getting older, and the kids think everything is fine." During the assessment, you complete the mini mental status examination, MMSE, and the client scores 18. As the PHMNP treating the client, you know the results of her MMSE indicate which level of cognitive impairment. A. No cognitive impairment. B. Mild cognitive impairment. C. Moderate cognitive impairment. D. Severe cognitive impairment. The correct answer is C. Moderate cognitive impairment. Cut points on the MMSE are as follows: total score 30, 25 to 30 questionable significance, 20 to 25 mild impairment, 10 to 20 moderate impairment, and 10 or lower severe impairment. You are the PHMNP treating Tim, a 10-year-old child, for ADHD and social anxiety disorder. His mother presents with Tim for his scheduled individual therapy session. At the end of the session, his mother says, "I need to take Tim to see his pediatrician, and at the last visit I was told he needed some HPV shot. I don't know, he's a boy, why would he need that?" What do you think? What is the PHMNP's best response to her question? A. The Centers for Disease Control and Prevention, CDC, recommends the human papillomavirus, HPV, vaccine for all boys and girls at age 10. HPV can cause cancer in both men and women, and the vaccine is effective in protecting against the virus. Can you tell me your concerns about Tim getting this vaccine? B. While the Centers for Disease Control and Prevention, CDC, recommends the vaccine, every parent has the right to choose, and if you do not think Tim needs this vaccine, as his parent you have the right to refuse. C. The Centers for Disease Control and Prevention, CDC, recommends the human papillomavirus, HPV, vaccine for older teenagers, starting at age 18, so you have time to research and think about your decision. D. My daughters received the vaccine, and I'm like you, I did not let my sons receive the vaccine. They don't need it. I agree, vaccines can be scary. Can you tell me your concerns? The correct answer is A. The Centers for Disease Control and Prevention, CDC, recommends the human papillomavirus, HPV, vaccine for all boys and girls at age 10. HPV can cause cancer in both men and women, and the vaccine is effective in protecting against the virus. Can you tell me your concerns about Tim getting this vaccine? When family members or clients ask questions about illnesses and treatment, it is the PHMNP's responsibility to provide data and then assess understanding and meaning. As a PHMNP working in a crisis evaluation center, you are aware that the initial focus of a crisis assessment is on which of the following? A. Client's past diagnosis and medication trials. B. Psychosocial history and supports. C. Safety of the client and others. D. Current living situation and coping skills. The correct answer is C. Safety of the client and others. In a crisis, the first assessment should be safety of the client and those near the client. When conducting a neurological examination on a client, the PHMNP asks the client to hold out her arms and stick out her tongue while assessing for tremors. Which cranial nerve is being assessed? A. Glossopharyngeal. B. Vagus. C. Trigeminal. D. Hypoglossa. The correct answer is D. Hypoglossa. The tongue is controlled by the hypoglossal cranial nerve. A 20-year-old Asian man who was recently diagnosed with schizophrenia comes to your office for a follow-up appointment. During the assessment, he talks about his experience in the group home, thinking that the television is sending him messages through news anchors during the 10 p.m. evening news. What symptom is the client describing? A. Paranoia. B. Illusions. C. Ideas of reference. D. Neologisms. The correct answer is C. Ideas of reference. Ideas of reference are misinterpretations of incidents and events that one believes have a direct personal reference to oneself. You are working with a family, mother, father, and 2 biological children. Sam, the father, is very rigid and controlling, which seems to be out of fear that something might happen to his family. He worries daily, and it affects his family relationships. You give Sam a paradoxical directive and instruct him to intensely worry about everything he can think of for 1 hour a day. Using a paradoxical directive is part of which therapy? A. Experimental. B. Structural. C. Strategic. D. Cognitive. The correct answer is C. Strategic. Paradoxical directives may be used in strategic family therapy. As a PHMNP working in an outpatient addiction clinic, you often refer your clients to community AA and NA meetings. Using Yalom's therapeutic factors, you are aware that peer-led groups can inspire and encourage other group participants. Which therapeutic factor is instilled in AA and NA group members? A. Hope. B. Altruism. C. Catharsis. D. Existential factors. The correct answer is A. Hope. Working in support groups such as AA and NA, hearing stories of others who had similar struggles instills hope. Which of the following client statements best describes imitative behavior as a therapeutic factor in group therapy? A. Group members talk over one another, so the loudest person is heard. B. Group members begin to model aspects of other members of the group and group leaders. C. Group members discuss past situations when they were bullied and felt ashamed. D. Group leaders take charge of the group and redirect members when they monopolize the group. The correct answer is B. Group members begin to model aspects of other members of the group and group leaders. As group progresses, the leader is less active, and the members of the group take over and begin to model other members and the leaders. Dialectical behavioral therapy, DBT, draws on cognitive theory and behavioral theory, along with other theories. Elements of behavioral theory in DBT include which of the following? A. Skills training and exposure. B. Examination of feelings and relating feelings to visceral sensations. C. Working through the transference with the therapist. D. Cognitive interpretation of past traumatic experiences. The correct answer is A. Skills training and exposure. DBT focuses on cognitive and behavioral techniques, mindfulness including meditation, and emotional regulation. Dialectical behavioral therapy, DBT, affirms dialectical thinking, which involves examining and discussing opposing ideas to find the truth. This philosophy is a supportive principle of DBT training. The central dialectical pattern emphasized in DBT involves the tension between A. Radical acceptance and change. B. Cue exposure and block avoidance. C. Problem avoidance and problem solving. D. Crisis survival and acceptance. The correct answer is A. Radical acceptance and change. DBT emphasizes acceptance of the current reality of what is and the ability to engage in personal change. Samantha is a 26-year-old partnered woman who works full-time as a teacher. She is in a long-term relationship with Mary, and they are getting along well, and doing well financially. They have 2 children, ages 2 and 6. Samantha is seeing the PHMNP to address her concerns that she is feeling down and sad for no reason and states, "I know my life is going well, but I just don't feel happy. I have always worried a lot, and have been sad most of my life." As a PHMNP trained in transactional analysis, TA, you understand that personality is multifaceted and wonder if which of the following is affecting her ability to experience happiness. A. She had long periods of separation from her primary caregiver as a child and now has a difficult time accepting and receiving love and experiencing happiness. B. She likely had a traumatic event in her childhood and her thoughts and feelings related to the event are locked together in her brain and cannot be accessed. C. Her unhappiness is likely related to distorted thoughts and feelings about her relationship. D. As an adolescent, she experienced an event that was processed in an ego state as an older sibling. The correct answer is B. She likely had a traumatic event in her childhood and her thoughts and feelings related to the event are locked together in her brain and cannot be accessed. According to TA, when a person is traumatized, the thoughts and feelings get tied together, and the process of therapy is to unlock the two. You have been working with a 54-year-old man who has been treated for schizophrenia since age 19. He has limited social interactions, likes to be alone, and has never dated nor had a desire to date. His symptoms are best explained by which of the following? A. Antisocial personality disorder. B. Lack of personal hygiene. C. Negative symptoms. D. Positive symptoms. The correct answer is C. Negative symptoms. Negative symptoms include flat affect, alogia, avolition, poor attention, and anhedonia. In the case study, the symptoms are avolition and anhedonia. Following evidence-based practice, which laboratory screening tests and assessments should be completed prior to placing a person on a second-generation antipsychotic medication? A. Serum glucose, lipid profile, weight, blood pressure, waist circumference, and family history of cardiovascular disease. B. Comprehensive metabolic panel, body mass index, complete blood count, and thyroid panel. C. Serum glucose or hemoglobin A1C, lipid profile, weight, body mass index, blood pressure, waist circumference, and family history of cardiovascular disease. D. Serum glucose, complete blood count, assessment of family history of cardiovascular disease and cancer. The correct answer is C. Serum glucose or hemoglobin A1C, lipid profile, weight, body mass index, blood pressure, waist circumference, and family history of cardiovascular disease. EB practice guidelines indicate that all clients should have the following prior to starting antipsychotic medication: fasting glucose or A1C, lipid profile, weight, body mass index, blood pressure, waist circumference, and family history of cardiovascular disease. Which type of hallucination is rare in persons with psychotic illnesses and is often associated with an organic etiology? A. Auditory hallucinations. B. Gustatory hallucinations. C. Visual hallucinations. D. Combination hallucinations. The correct answer is B. Gustatory hallucinations. The most common type of hallucinations in persons with psychotic illnesses are auditory and visual. Tactile and gustatory hallucinations are less common and more likely related to an organic illness. What differentiates atypical antipsychotic medications from first-generation or typical antipsychotic medications? A. 5-HT2A receptor antagonist properties. B. 5-HT2A receptor agonist properties. C. Specific dopamine receptor 3 and 5-HT2A blockade. D. Dopamine receptor 2 antagonist properties. The correct answer is A. 5-HT2A receptor antagonist properties. Typical antipsychotic medications block D2 receptors. Atypical antipsychotic medications block D2 receptors and have 5-HT2A antagonist properties. You are treating a client with schizophrenia who takes clozapine. What laboratory values will indicate the client needs to discontinue treatment? A. White blood cell count of less than 1,800 per cubic millimeter and absolute neutrophil count of less than 1,200 per cubic millimeter. B. Absolute neutrophil count of less than 1,000 per microliter. C. White blood cell count of less than 1,200 per cubic millimeter. D. Absolute neutrophil count of less than 2,000 per microliter. The correct answer is B. Absolute neutrophil count of less than 1,000 per microliter. The recent change in monitoring clozapine clients using the Risk Evaluation and Mitigation Strategy, REMS, indicates persons treated on clozapine need to have absolute neutrophil count monitored and, If it drops below 1000 per microliter, treatment must be interrupted and can be resumed once the absolute neutrophil count normalizes above 1000 per microliter. Sean is a 47-year-old Gulf War veteran who was in combat during Operation Desert Storm. Sean has been treated by the PHMNP for major depressive disorder and associated anxiety symptoms. During the most recent visit, the PHMNP learns that Sean sustained a traumatic brain injury during his service, which was recently diagnosed at the TBI clinic in the Veterans Affairs Clinic. What is the rationale for the PHMNP to taper Sean off clonazepam? A. Benzodiazepines causes memory problems and confusion in clients with a history of a TBI. B. Benzodiazepines lower the seizure threshold in clients with a history of a TBI. C. Veterans Affairs has banned benzodiazepines from the medication formulary. D. Benzodiazepines place clients with a TBI at risk for a second head injury. The correct answer is A. Benzodiazepines causes memory problems and confusion in clients with a history of a TBI. Benzodiazepines are contraindicated in clients with a TBI due to increased rates of confusion and memory problems. Alice is a 68-year-old woman who presents to you with concerns about her memory. She explains that her mother and grandmother both experienced dementia, and she wants to do what she can to prevent this terrible disease. Alice is treated for hypertension, which is well controlled. Other than that, she is in good health. She is socially and physically active and participates in a monthly cooking class, volunteers at her church, and plays bridge twice a week at the senior center. She says, "I understand that I am losing brain cells at my age, but I would still like to keep my mind and body active." Which is the best response to Alice? A. You are correct that you cannot form new brain cells at your age, but you should continue with your activities because they offer excellent physical and mental health benefits and in turn will lower your risk for dementia. B. Although most brain development occurs early in life, we still form some new brain cells in a couple of areas of the brain during adulthood. You should continue with your activities because they offer excellent physical and mental health benefits and are neuroprotective. C. Scientists now know that we do continue to form new brain cells throughout the entire brain during adulthood. Continue with your activities because you are producing new brain cells in the frontal lobe, and this will decrease your risk of dementia. D. You should continue the social activities such as bridge, volunteering, and the book club, but should consider the risks and benefits of physical activities such as dancing. If you were to fall and break a hip, this could lead to prolonged hospitalization, loss of independence, and ultimately increase your risk of dementia. The correct answer is B. Although most brain development occurs early in life, we still form some new brain cells in a couple of areas of the brain during adulthood. You should continue with your activities because they offer excellent physical and mental health benefits and are neuroprotective. While it was once thought that brain neurons did not regenerate, we now know that while most brain development occurs early in life, we continue to form some new brain cells throughout life. As we age, we need to engage in activities that keep our brains healthy by encouraging this growth. Examples are diet, exercise, socialization, and cognitive stimulation. What is the best treatment for AIDS dementia complex? A. Acetylcholinesterase inhibitors. B. Symptom-targeted pharmacologic treatments. C. Non-pharmacologic supportive care. D. Antiretroviral therapy. The correct answer is D. Antiretroviral therapy. All persons with AIDS should be treated with antiretroviral therapy. Those who develop dementia complex should have those symptoms treated with appropriate pharmacological or non-pharmacological interventions. As a PMHNP working on the consult liaison team, you know the importance of preventing delirium due to which of the following? A. Risk of 1-year mortality rate. B. Risk of harm to the client and staff. C. Risk of unremitting psychosis. D. Risk of aspiration. The correct answer is A. Risk of 1-year mortality rate. Studies have identified high rates of mortality post-hospitalization for delirium, so the best treatment is prevention. When working with a 26-year-old, Mike, who presents for treatment of cannabis use and gambling, you use motivational interviewing techniques. As a PMHNP, you are familiar with the core counseling skills used in motivational interviewing. Mike made the following statement: "I don't know why I came here in the first place, but I thought maybe some medication would help me." You respond by saying, "You're feeling confused about the process," and Mike replies, "I never thought I'd need to come to a place like this." You respond, "You kept your appointment today, and I appreciate the courage it took for you to come here." What two motivational interviewing techniques are used in this interaction? A. Interrupting and reassurance. B. Affirming and reflecting. C. Open-ended questions and summarizing. D. Clarification and data collection. The correct answer is B. Affirming and reflecting. When a person is in contemplation stage, interventions should be affirming and reflecting. You are a PMHNP working in a hospitalist role on an acute inpatient psychiatric unit at a local hospital. As you make rounds, the registered nurse informs you that a 32-year-old client who was admitted for alcohol detox has a score of 17 on the Clinical Institute Withdrawal Assessment for alcohol. What phase of withdrawal is this client in? A. Mild withdrawal. B. Moderate withdrawal. C. Severe withdrawal. D. Delirium tremens. The correct answer is B. Moderate withdrawal. CIWA cutoff scores are as follows: 0 to 9, absent or very mild withdrawal; 10 to 15, mild withdrawal; 16 to 20, moderate withdrawal; and 21 to 67, severe withdrawal. A client who has been addicted to opioids has not used in 15 days. During your medication management visit, the client states, "I'm going to die from not having my opanas. You need to give me something now." The PMHNP's best response is A. I know you are feeling very uncomfortable, and we need to get you to the emergency room immediately to prevent a seizure. B. I know you are feeling very uncomfortable. Let's take your vital signs and talk about a trial on catapress to treat your withdrawal symptoms. C. You have been using Opana for a long time, and it is going to take several months for the withdrawal to end. In the meantime, I will see you weekly. D. There is no treatment for opioid withdrawal. You will have to wait it out. The correct answer is B. I know you are feeling very uncomfortable. Let's take your vital signs and talk about a trial on catapress to treat your withdrawal symptoms. Opioid withdrawal symptoms can be treated with central alpha agonists. Signs and symptoms of cannabis intoxication include A. Increased sensitivity to external stimuli. B. Enhanced motor skills. C. Fast passage of time. D. Lower heart rate. The correct answer is A. increase sensitivity to external stimuli. Persons intoxicated on cannabis exhibit distorted perceptions, increase relaxation and sensitivity, and loss of coordination. Which defense mechanisms are commonly used by persons with obsessive-compulsive personality disorder? A. Rationalization, isolation, and intellectualization. B. Projection, distortion, and hypochondriasis. C. Regression, somatization, and dissociation. D. Sexualization, displacement, and reaction formation. The correct answer is A. Rationalization, isolation, and intellectualization. Persons with obsessive-compulsive personality disorder use defense mechanisms of rationalization, isolation of affect, and intellectualization to make sense of their behavior. You have been working with Cody, a 30-year-old single man, in weekly individual psychotherapy for 3 weeks. At the start of session 4, he says, "I noticed when I came in that your usual parking spot has a new car in it with temporary tags, and it's a BMW. Nice car." What is the best response from the PHMNP psychotherapist to Cody? A. Thanks for noticing, it is a nice car. B. How do you know what spot I park in? C. I noticed you drive a BMW as well, how do you like your car? D. Sounds like having expensive things is important to you. The correct answer is D. Sounds like having expensive things is important to you. In a therapy relationship, the therapist should try to understand the meaning of a client's statement rather than engage in social conversations. When working in individual psychotherapy with a client who has a personality disorder, what are the primary treatment goals? A. Change the client's personality structure and make him or her more adaptable in everyday life. B. Reparent the client, following Bowlby's theoretical framework. C. Allow the client to reprocess his or her childhood trauma, because all clients with personality disorders have a history of severe abuse. D. Assist the client in changing dysfunctional interpersonal relationships and use of immature defense mechanisms. The correct answer is D. Assist the client in changing dysfunctional interpersonal relationships and use of immature defense mechanisms. Persons with personality disorders have a pervasive maladaptive pattern of behavior, and the goal of therapy is to slowly shift how they relate in the world and begin to use higher-order defenses. For a client who has paranoid personality disorder, what are the best treatment strategies? A. Confront negative and misinterpreted thoughts and feelings. B. Deflate grandiose thoughts. C. Engage the client in detailed and emotional responses and dialogue. D. Do not challenge negative views or recollections of events. The correct answer is D. Do not challenge negative views or recollections of events. Persons with fixed false beliefs should not be challenged. John, a client with paranoid personality disorder, states the following: I noticed there is a red light in the upper corner of your door, and it has been going on and off during our sessions. Are you recording me? What is the PHMNP best response? A. No, it would be illegal for me to record you, and that is not a camera, it's just a red light. B. John, thank you for asking the question. The light you see in the upper corner of my door tells me when a client has arrived and is in the waiting room. The client turns on the light, as you do, when they arrive in the waiting room, alerting me their arrival, and I turn off the light when we get into the office using the switch by my desk. C. Come on, John, do you think I would record your sessions? You are not that interesting. I'm just kidding, no John, it is not a recorder or camera. D. John, it takes courage to ask me the question. Tell me a time in your life when you had a similar experience. The correct answer is B. John, thank you for asking the question. The light you see in the upper corner of my door tells me when a client has arrived and is in the waiting room. The client turns on the light, as you do, when they arrive in the waiting room, alerting me their arrival, and I turn off the light when we get into the office using the switch by my desk. When working with a paranoid client, help the person find proof of meaning and explain any questions in a matter-of-fact manner. As a PHMNP, you understand the genetic factors that contribute to psychiatric and personality disorders. Persons who develop antisocial personality disorder often are raised in families with high rates of which of the following? A. Psychotic disorders. B. Alcohol use disorders. C. Anxiety disorders. D. Mood disorders. The correct answer is B. Alcohol use disorders. Being raised in an alcoholic family increases the likelihood of chaos, unpredictability, and lack of rules and order, leading to higher rates of developing antisocial personality disorder. Persons with obsessive-compulsive personality disorder often use isolation as a defense mechanism. Which of the following examples best describes isolation as a defense mechanism? A. Staying in the house for days or weeks to clean. B. Declining invites by friends or family to attend social gatherings. C. Describing information with very little effect variation. D. Being an introvert in the work setting to prevent talking with coworkers. The correct answer is C. Describing information with very little effect variation. Isolation is a defense mechanism often used by people with obsessive-compulsive personality disorder and has to do with affect and emotion rather than getting out and being social. In the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, how should a personality disorder be coded? A. Coded with the major psychiatric disorder. B. Coded on axis 2. C. Coded on axis 3. D. Coded on axis 4. The correct answer is A. Coded with the major psychiatric disorder. DSM-5 no longer uses the axial system. When prescribing a selective serotonin reuptake inhibitor, SSRI, for a child or young adult up to age 24, what education must be included? A. Black box warning about increased suicidality in this population. B. Black box warning about increased risk of mania in this population. C. Risk of sexual side effects on this class of medication. D. Risk of stomach upset and headaches, to prevent unnecessary primary care visits. The correct answer is A. Black box warning about increased suicidality in this population. The SSRIs all carry a black box warning for increased suicidal ideation for this age group. Tommy is an 8-year-old who presents to the PHMNP for evaluation of attention deficit hyperactivity disorder. His mother completed the Vanderbilt ADHD rating scale and brought in the Vanderbilt teaching rating scale. Both your clinical interview and the rating scales indicate Tommy has ADHD. What assessment indicator need to be completed prior to starting a stimulant mediation? A. Get a copy of the rating scale, completed by his grandparents. B. Assess for family history of cardiovascular disease and, if positive for conduction problems, order an electrocardiogram before prescribing medication. C. Obtain blood pressure and pulse, and begin the stimulant medication. D. Assess for a family history of bipolar disorder. The correct answer is B. Assess for family history of cardiovascular disease and, if positive for conduction problems, order an electrocardiogram before prescribing medication. American Academy of Child and Adolescent Psychiatry practice parameters require physical exam, pulse, weight, height, and blood pressure workup prior to the start of stimulant medication. Because his grandfather had a cardiac conduction problem, an electrocardiogram, ECG, should also be obtained prior to the start of medication. A mother brings in her 7-year-old son for a psychiatric follow-up visit with the PHMNP. This is the 4th visit the PHMNP has had with the client, his mother, and his younger sister, Renee, now 7 months old. You notice that she has a decrease in head growth, along with stereotypic motions of the hands, often licking and slapping. Renee has also lost her language skills. What medical condition do you suspect Renee has developed? A. Autism spectrum disorder. B. Rett syndrome. C. Selective mutism. D. Childhood onset diabetes. The correct answer is B. Rett syndrome. Girls with Rett syndrome develop normally and around the 7th month regress, with a decrease in head size and language loss. You are treating Timothy, a 16-year-old boy, for an eating disorder. Timothy is of normal weight and socially extroverted, at times appearing to seek attention when in a peer group or class. Timothy's symptoms are most consistent with which eating disorder? A. Anorexia nervosa. B. Bulimia nervosa. C. Binge eating disorder. D. Anxiety-induced eating disorder. The correct answer is B. Bulimia nervosa. Clients with bulimia are often of normal weight or overweight and are outgoing. You are treating a 14-year-old female for attention deficit hyperactivity disorder, ADHD, who has a family history of bipolar disorder. As a PHMNP familiar with symptoms of both ADHD and pediatric bipolar disorder, you know the following are overlapping symptoms of both disorders. A. Excessive talking, increased activity, and distractibility. B. Irritability, sleep problems, and mood swings. C. Excessive talking, irritability, and sleep problems. D. Sleep problems, mood swings, and distractibility. The correct answer is A. Excessive talking, increased activity, and distractibility. Clients with ADHD and bipolar disorder often have excessive talking, increased activity, and distractibility.